Welcome back to Real Talk with Real People. My name is Dr. Caroline Bethea Jones, and my subject matter today is going to deal with the loss of a child. I believe that the worst thing that can happen to any parent is the loss of a child. So this is going to be a subject that is hard to talk about. It is hard to talk about death, especially if the death involves a child. Because for parents who have lost a child, the pain is indescribable. So I want you to stay tuned as we welcome my next guest, Miss Tia Robinson. She's going to tell us her story. She's going to share her journey with us. So welcome, Tia, to our show. How are you today?
I'm good. Thank you so much for having me.
Oh, thank you for coming, because you're going to tell your story, right?
Yes.
So we're going to give you the opportunity to share with us your story, share with us your journey, offer some advice to some of our listeners, offer some advice to me and everyone who wants to get to know this story and what it feels like to be a part of your journey. Okay, so why don't we get started? Why don't you tell us a little bit about yourself?
I am a 41-year-old stay-at-home mom right now. I have a 12-year-old who's going to be 13. I actually lost a 23-year-old about 4.5 years ago.
I didn't know that.
To childhood cancer.
Oh, okay.
Yes.
All right. I thought she was younger. I'm sorry. I thought
she was diagnosed at 15.
Okay.
And she passed away at 23.
Oh, okay. Still a young woman.
Still a young woman.
Mm-hmm.
Never really got a chance to do much because, she was sick. So she had been going through some little medical issues, like chronic nosebleeds, and they had diagnosed her with asthma when she was like around 14, and like a lot of gastro stuff. They said she had acid reflux and just all these things that, they said she had.
All while she was growing up, though, all through her childhood.
Right, while she was growing up.
Okay.
And then she started getting nebulized very often because they said she had asthma. So she's, back and forth to the ER and, getting nebulized. And this one particular day when she went to the emergency room, I was still at work. My mom actually had gone with her, and they nebulized her twice, and they never had to do that before.
Now, how old was she? Just for the sake of our audience.
At that time, she was 15.
She was 15. But up until the time she was 15, she had been going back and forth to the doctor.
Yeah, and it would be like, one breathing treatment, and then they started giving her a singular pills that they told her to take every day, and then she had some other breathing medicines that she had to do at night.
And when was she, I just want, for the sake of everybody who's listening, when was she first diagnosed with asthma? Because a lot of black children are diagnosed with asthma. I want to make sure that we talk about that a little bit. It was
probably like around 13 or 14.
Okay. But prior to that, she had been having issues too,
She
right?
had been having like little breathing issues. Mommy, I'm short of breath. But she played basketball.
Okay. So
it was always, it's because she's an athlete.
Okay. All right.
So then when they did the first nebulizing, it didn't seem to work.
Okay.
And they had to do another one. So they did that, and that one still didn't seem to do much. So my mother called me, and she said, listen, I think you should come up here. And I said, I really can't, what's going on? I have so many patients to see. And she said, the nebulizing is not working, and, Tisha's getting scared, and you really should come. So I said, okay.
Okay. You said so many patients to see.
Yeah.
So are you a doctor?
A phlebotomist.
Okay. All right. Because we were wondering. Okay, is she a doctor?
No, I'm a phlebotomist.
Okay.
I've been in the medical field since '98, actually.
Oh, okay.
And I did in-office phlebotomy.
Okay.
So I had the opportunity to work next to a lot of many different doctors, whether it's a primary doctor, a specialist, a pediatrician. So I have a little bit of knowledge of,
Yes.
So I get up to the hospital, and, she's in the room, and she's like, Mommy, my side is hurting. And I'm like, well, how's your breathing? And she's like, it's okay, but my side is hurting. So I'm like, all right. So the doctor comes in, and the doctor says, she has been complaining about her side. We really don't know, what it is, but we're going to do an ultrasound just to see.
Okay.
She said, I don't think we're going to find anything, but because she's complaining, we got to do something. So they sent her for the ultrasound. We're in there. We're laughing and giggling, having a grand old time. They did the ultrasound. On the way back, the nurse says, make sure you get dressed, put on your clothes. You know, we're going to get the discharge papers and you're going to be discharged.
Mm-hmm.
So we're doing that. We're sitting on the edge of the bed waiting for the nurse to come with the papers. And we see, you know, all the white coats coming down the hall, but we're in an emergency room.
Mm-hmm.
So you see this all the time. It probably was about 12 people. And they came into our room.
12
And-
doctors
Yes.
came into your
Yes.
room. That was scary.
Very, very.
Okay.
Doctors, nurses, technicians, everything.
Okay.
And they said, no, you're not going anywhere. And I said, well, what's going on? They said, well, we found something on the ultrasound that looks like a sack of fluid. So, you know, me being a single mom, I'm like, listen, drain it, send it off to pathology, let us go. I got to go to work tomorrow, you know. And the doctor says, no, we can't do that because we don't know if it's solid. So I'm like, solid? And she says, yeah, it may not be a sack of fluid. It might be something else. So we're going to admit her. And we're going to do other tests. So, okay. So they did that. We did more ultrasounds. We did x-rays. We did CAT scans. They did MRI. They did everything. Blood work, you name it, they did it. So they saw that it was a tumor and that it was solid. And at that point, they weren't really sure, you know, how to go about. They wanted to get a piece of it, like a biopsy.
Right, right.
And
now,
they-
this is in her lungs.
It was actually, the first tumor was growing. It was attached to her diaphragm.
Her diaphragm.
And it was
okay.
growing up into her chest cavity, which is a part of why it was so missed.
Okay.
Because it wasn't protruding out. It was growing up into soft tissue.
Okay.
So, and like her organs and things like that. So they were, you know, going back and forth each day on how to do, you know, get the sample. They didn't know, should we go in through the front? Can we go in through the side?
Okay.
We probably would get a better piece if we went in through her back, but it's so close to her spine. So it was just a lot of, you know, worry.
Right, right.
So finally they decided to do an ultrasound guided biopsy.
Okay.
They gave her like a little twilight. She did it in radiology. It wasn't like an OR procedure. And it was actually very quick. They did it very quick, and she was fine. Waiting for that to come back, she's still tremendous amount of pain, having trouble breathing. They're still nebulizing, treating all her pre-existing conditions.
Yeah. And I'm sure she was scared too.
Yeah,
At
yeah,
this time.
right.
Yeah.
So then we got, the pathology came back inconclusive. Was
Okay.
not enough specimen.
Okay.
So now they're like, well, how can we do it again? We need to go in and get more specimen and maybe take more so that we can find out what this is, so we'll know how to remove it. So in the midst of them trying to figure that out, the pain just became unbearable. She couldn't even stand up. And the team came in for the surgery. They said, we got to go in. We got to operate. We don't even know how to go in. We don't know how to even do the incision. You know, the surgeon was very honest with me. He said, I'm not sure what I'm going to see. I'm not even sure how to go about getting in there. So he said it would be maybe about a 2-hour procedure, which turned into hours.
Of course.
And when they did the surgery, he came out with this picture and he said, this is what I just removed from your daughter. 5-pound tumor, humongous. It was huge.
And had been growing for years.
Had been growing for years. It had to have been for it to be 5 pounds.
Wow.
You know, I don't think it just grew overnight, you know.
Right.
So once they removed the tumor, all of her pre-existing situations were gone. No more breathing issues, no more asthma,
Okay.
no more acid reflux, no more any of those things. So she recovered from the surgery very well. She did like 3 days in ICU, and then she did like 3 days on the main floor, and home we went.
Okay. How was her spirits? Good?
Great.
Great.
It was
Because
great.
she was in no more pain.
She was in no more pain. The fresh out of surgery, the very next day, you know, like they really get you up and moving,
Right.
you know. And at first she was like, oh my goodness, like, Ma, like I can't move, I can't do this, I can't, you know. And I'm like, you have to try. And there was one nurse she was so sweet. She said, listen, I don't mean to be harsh, but if I don't move her, it's going to be problematic later.
Of course, yes.
And so I understood that, being in, the
Right.
medical field.
You're in the field,
so
right.
I totally understood that. So I'm explaining it to her, like, you just got to try. We could do it slow, but you
Right.
have to do it. And she was grateful for that in the end, because of that nurse, every single surgery, she was like up and moving.
Okay.
Up and moving.
Good.
So we get discharged from the hospital thinking, we're going on with our life. Surgery's over, tumor's removed, you're good. The day after Thanksgiving, we got a call. Now, before they called with this, it was, they kept sending it places. They sent it to the pathology within the hospital. They did not know what it was. Then they sent it to like a medical school. They didn't know what it was. They sent it all over. And every time they sent it back, the doctor would call and say, listen, we still don't have an answer yet as to what this is. So the day after Thanksgiving, they had an answer. And they called me and they said, you have to come in because we have to start discussing treatment that includes chemotherapy. And so we go into the hospital, and they said that they had sent it to the Women's and Children's Hospital in Boston. That's who determined that it was something called rhabdomyosarcoma, which is cancer of the connective tissue and muscle. And so they said that she had to do 46 weeks of chemotherapy, which is 4 cycles. One cycle is about 11 or 12 weeks of treatment. It was very harsh, very, very harsh, very rough, very hard, just to watch that whole situation.
Okay.
So that went on for 46 weeks. And she bounced back pretty well, even though, she lost all her weight, lost her hair, went through that whole thing.
Right.
She kind of bounced back pretty quickly. She was cancer-free for a year, like a year and a half.
Okay.
For it did return. She had another tumor. Now the tumor was kind of in the chest area, not in the diaphragm. It had kind of moved up.
Okay.
So she had that.
Is that normal? Is being in the medical field, is that normal?
Well, for the type that she has.
Okay.
There's 4 different types. I can't really think
Right,
of all the names of them right now, but if you have them on the brain or the neck or the head, that's one type. If you have it on a limb, that's another type. If you have it in the torso area, that's a different type, and that's the type that she had.
Okay.
I mean, they call it all rare. When you have hospitals and hospitals and hospitals full of kids fighting this, I don't see anything rare.
Okay.
But when you look at cancer as a whole, it is very rare for a child to have cancer,
What are some of the causes, do you know?
I don't really know the cause. I have my suspicions.
You want to share your suspicions?
I definitely have my suspicions. We eat a lot of crazy stuff.
Yeah.
They've been telling us for years and years and years not to drink the water. My daughter did a lot of research on her own because she didn't understand why she had this and
Not
where
to
it came
drink
from.
the water where you lived, or
Yeah, like they say, drink bottled water. Like, don't drink anything from the tap. But we
tap.
shower with it. We cook
Okay.
with it. We
Yeah.
do all these things with that water. So, I mean, it could be environmental. Where my daughter went to school, like all around the school, they were knocking down buildings that were there for 50, 60 years, and they're knocking these buildings down, and they're disturbing the ground, and they're digging, and they're, and then even in one part of her school, like there's a part of the school that's closed. Like you can't even go there because of all the stuff growing in the ceiling. And the school is still, so I have my suspicions.
okay, we'll leave it at that. But know,
Yeah. So
has there been any other cases other than your daughter?
Oh, yes.
Okay.
Oh yes.
All right.
There was actually a young
Because you look
man.
like someone who will do their research.
Oh yeah.
And
Oh yeah.
yeah,
Yeah.
you look savvy enough to.
There was a young
Yeah.
man who had he didn't have what my daughter had. He had like a kidney cancer, a tumor on the kidney, and when they found that, it was like quickly he was gone. It was very quick, and
That's sad to hear.
I just so happened to know the family, so I was in shock because I knew the kid. I watched the kid grow up, you know what I mean? So it was a shock to me. And then after that happened, it was my daughter, and it's like it's just more and more kids that are coming up with these tumors. Now, years ago, it was leukemia.
Right.
Now it's these tumors, and nobody seems to know where these tumors are coming from, and when I did call, I called the city to see about the environmental stuff and how can we find out, and it was kind of brushed off. They were like, oh, if that was the case, you won't find out for about 15 to 20 years later that was what caused, whatever.
Sadly, that's true, though.
So, yeah.
But you don't strike me as a individual who just let things roll off the back.
No, I do a lot of research.
You strike me as someone who does.
Yeah, and sometimes with the research that I do, it pushes me to do more research, because it's like I'll find out something in one area and it's like, okay, wait, now that has developed more questions, so I have to go and research all of that. So yeah, it does, definitely. I research a lot. I try to find out my own answers and not listen to what everybody says. I try to look things up and,
So when they told you that another tumor developed in her chest cavity, what was the procedure after that? They went in again to remove it?
Yep. Same thing. Surgery, chemo.
Not the same type of chemo that she had.
Not the same type of chemo, because they say once you take a chemo, your body kind of builds a resistance to it. So you have to take something different, maybe a little stronger, a different drug.
Okay.
So she didn't take the same drugs. She took the same drugs for the side effects, because it's all the same side effects.
Okay. What are some of those side effects?
The nausea is like the worst. The metal taste is another situation. My daughter had neuropathy where we would be in the supermarket and she would walk right out her shoes. Didn't even know she walked out of her shoes because she really literally couldn't feel the bottom of her feet, from the chemotherapy. And there's tons of medication for it. They give you so much stuff. So she had the neuropathy, she had the nausea, she had the vomiting, she had the metal taste, of course the hair loss, the weight loss, the mood swings, the anger, like all of those are side effects.
Right.
And there's a pill for everything.
With more side effects.
With more side effects. Yes. Yes. So, and that's pretty much what was our life, pill after pill, So once the cancer came back the second time, she did have surgery. They removed it. She was on chemo, not as intense as the first one, like not as often. It was like a little more spread out. Like she used to do it every week, like 6 weeks, a week off, then 6 weeks. So it wasn't that intense. But while she was on the chemo, after the surgery, the tumor grew back, actively on treatment. So at that point, we're like, okay, you guys are saying that the chemo is supposed to stop this thing. She's taking the chemo, the tumor was removed, and another one grew.
While she was taking the chemo?
While she was taking the chemo. So they said that was because she never had radiation. So what we're going to do is we'll stop the chemo, which they really did not want to do. We'll stop the chemo. We'll talk to the surgeon, have this thing removed, but at that point it was very small. So the surgeon is like, well, unfortunately, we're either going to try to shrink it with the radiation, or we're just going to wait and let it get a little bigger before we do surgery, because that's how small it was. But she felt it. She felt it. She knew something wasn't right. And so we did that. We did the radiation and, surgery, and back on chemo again, and there it was. It came back again, and this time it was a little further up in the chest. Now, she had a cyst when she was 2. They removed that cyst. When she came out of surgery, she did like they called it pooling. Like her chest started to kind of blow up, and like the blood was collecting on the inside.
Okay.
So she had to go back in so that they could drain that and find out what was bleeding in there, and take care of all of that. The same thing happened. The same thing happened in the end with the last surgery. She started pooling in the chest area around the heart. And they had to rush her out of ICU for emergency surgery. And the doctor said, I'm going to put her to sleep. I'm going to have her on a breathing machine when she comes out because she needs to stay still and she needs to rest. So that was very scary to see, her being pushed back in the room with this machine and all these tubes and all this stuff coming out of her. And so with that being said, it makes me question what was that when she was 2, because they always say cancer goes back to its original place.
So she had a cyst in that area when she was 2.
Yes.
They removed it?
They removed it. It came back subcutaneous cyst. But this was in 94. So the technology that we have now, we certainly did not have in 94. Did they even check it for cancer? I don't know. I don't know.
Very scary.
Oh, yes.
Very scary thought.
Yeah.
Yeah.
But then, I look at the flip side of that too, and I say, okay, well, Tia, if that was cancer at 2, and she went through 7 years of what she went through at 15, she would have been 9 when she left here. So I thank God I had her for 23 years.
Yeah.
So it's not fun, but.
You are incredibly strong, though. As I sit here and listen to your story, my heart is breaking and I feel choked up. And I look at this beautiful woman sitting across from me who you appear like you have so much under control. I don't even know if I could even. I feel teary-eyed myself right now.
I'm going to tell you how. Me and my brother are like, we should have been twins. I'm telling you, we should have been twins. He came out from California, getting towards the end. And after my daughter passed and we, had the services and everything, because, she planned everything. She planned everything herself.
Okay. Strong like her mother.
Yeah, she really was. And she was a jokester about it, too.
Oh.
As my brother, I'm taking him to the airport. He gets out the car. We go inside. He's about to board the plane. He said, listen, sister girl. And this is where I get teary-eyed because this is really what, keeps me grounded. He said to me, listen, it's okay to cry. It's okay to jump up and down. It's okay to roll on the floor and all of that. He said, but do not let it consume you. Because no matter what you do, she is not coming back. And you have to keep going. So when I get, to those moments where I'm crying and I'm angry and I just hear my brother's voice and I have to say it's only for a moment. I have to get it out that moment and then I have to pull myself together and keep it moving. Not to say that there aren't days where I don't want to get out the bed, because I have those days too where I'm like, you know what? I'm not moving. I'm not going anywhere. I'm not answering my phone. But I can't let it consume me. I give myself 2 days, and a lot of times it doesn't even last that long, and then I just keep moving. Something else will come that'll, ignite me, and I'm like excited, like, okay, well, let me do this. Let me focus on that. So, it's not an easy journey. It's good days, bad days, happy days, sad days.
Right. You are truly a very strong, you're stronger than you think. You're not giving yourself enough credit. I'm sitting here and I'm watching you. You're not giving yourself enough credit. I just want to say that.
Thank you.
You are. Truly. So you had some help in the process when she had to stay in the hospital. I can imagine it was costly.
Oh, yes.
And,
well, I had great insurance.
Okay.
My grandmother taught me that.
Okay.
I remember when
Let's give it up for Grandma.
when I got my first package from the job for insurance and I brought it home to Grandma and I said, I can't pay for this. I'm not paying for this. This is every 2 weeks. And she said to me, she said, it doesn't matter if you get the cheapest one or if you get the most expensive one. You're still going to pay the same amount of money in insurance a year. The cheapest one, you're just going to come out of your pocket more and you're going to feel like you don't have insurance. She said, pay for the biggest one. You worry about your deductible and then everything else is covered. And she was right. She was right. So yes, I had deductible to meet, which was very easy to meet when you have a sick child.
Yes. Yes.
And once that deductible is met, everything is pretty much taken care of.
Okay, great.
But during the process, these people, doctors are human. They're human. It's political, unfortunately. It's very political. And it did get to the point where certain doctors weren't participating anymore with her insurance.
Okay.
And it was either you go someplace else, you see somebody else, or you switch your insurance.
Okay.
So we played the switching of the insurance game for a while, back and forth, because I didn't know what else to do. I knew she had been there for a few years. She was comfortable. I was comfortable, with her treatment. So it's like, I don't want to take her from here to someplace else.
Okay.
So we did the switching of the insurance for a few years. But then, I'm remembering the things that I did on my job for patients, fighting the insurance company and getting them to pay this and getting them to pay that. And I'm like, wait a minute. I can do this for myself. I need to do this for her. So when it got time for her to have the surgery before the last, that surgeon was no longer affiliated. Well, he was, not that he wasn't affiliated. He wasn't affiliated with the clinic. He was still affiliated with the hospital, but not with the clinic.
Okay.
So they didn't want me to use him.
Okay.
They said, no, you can't use him. You have to use this other doctor who came in. They give you the sun, the star, and the moon. They're wonderful. They're fabulous. And I said, no, I don't think, we're going to do that. Tish is not comfortable with this doctor. Before Tish got treatment, surgery, anything, she researched these doctors like she was about to give them a job for real.
Like I can see this running in the family, and I can see it starting with your grandmother.
Yeah.
You're some smart young ladies here.
Yeah. And it was so funny because when they told her who the new surgeon was, she took her old surgeon's bio and she put it next to the new surgeon's bio and put it on Facebook and said, who would you guys choose?
Wow.
The surgeon that she wanted, his bio was 2.5 pages. So she's like, he has more experience. Excuse me, he has more, so she was more comfortable with him.
Okay. And he had been her doctor
for years.
Okay.
From the very beginning.
Okay.
From the very beginning. And he was such a great man. Tish, when she had that first surgery when she was 2, she keloid. And she was very concerned about that. And she said to the surgeon, listen, however you cut me, I'm going to have a huge, ugly scar. And he said, don't worry about that. I'll take care of it. So after every surgery, he performed plastic surgery on her to make sure that she didn't scar. Right. Most doctors won't do that.
Yes,
they'll have you come back and say, okay, you got to do that separate. And it's not covered by insurance.
Right.
So, she chose him. And because he wasn't affiliated with the clinic, made him not affiliated with the insurance anymore.
Okay, so he would have been out of network.
Yes. Right. So I'm like, wow, what am I going to do? So the office manager, we had developed a relationship because I'm always on the phone with them, scheduling appointments, getting pathology reports, and so on and so forth. So I said to her, what can I do? She said, only thing that we could do is just let him do the surgery, and we just have to fight. We got to fight the insurance company to get him paid. So I said, okay. I said, I'll help. But you get denied, send me the letter. I'll write and I'll send it in, and, we will appeal it. And that's what I did. And the insurance companies are trained to deny the patient 3 times. They're trained to do that. They're trained to deny the doctor 5 times.
Okay.
So most people won't fight that long. So what I ended up doing was the very first denial that was given to me, I wrote a very lengthy letter speaking about the doctor, speaking about the treatment, why it was important that he stayed her doctor, just everything. They still denied it. I took the same letter. I only wrote a letter one time. I took the same letter, I changed the date, and I sent it in again. I did that 3 times, and they paid him.
Look at you.
And I had to do it every time.
We're going to learn a lot from you today. I really feel like you're going to teach us a lot today.
It's work, but
Yeah.
people think that they have to really sit down and examine this letter, pick it apart, answer each paragraph. One letter, 9 times out of 10, they're not reading it. They just want to see that you're fighting.
Okay.
You know, they deny it, you appeal it. Okay, they appealed it once, so we got to deny it again. They deny it again, you appeal it again. Okay, they appealed it again. You know, so let's give her another denial. When you send that third denial in, they got to pay. They have to pay.
Okay.
And they paid him, and what is bothersome to the insurance company is now, because he's out of network, you have to pay him the full benefit.
Right.
And that's what they don't want to do.
Now, if they paid him once, is that like a precedent? So if it would have happened again, they would have had to pay him the second time? Or you
No,
still have to
you
go through
still
that
have to
fight?
go
You
through the
still have
fight.
to
Yep.
fight it every single
Yep,
time?
every single time,
Okay.
because he's not in network.
Okay.
So every single time he did anything to her,
Okay.
you
had
know,
to fight.
I had to fight.
Okay.
I had to fight. And the office manager said to me, she's like, wow, I wish everybody was like you, because you really take such a load off of me.
Well, I just wish everybody was as interested in their self the way you are, to fight for their selves and their children and their anything the way you have.
Yeah. She was comfortable.
That's a testament all by itself. Your fight. You have a fighting spirit that I so admire right now.
Oh, thank you. Thank you. Thank you. So, you know, it was definitely a fight. But again, like I said, it was the same letter. I never wrote the letter. I wrote it one time.
But you were persistent.
I would just change the date and mail it and fax it.
Okay.
Mail it and fax it every single time.
Okay.
And they would send the denial to the doctor first, and she would call me, and I would look for my denial, and I would tell her, don't worry about it, I got it. What date do you have? And I would date my letter off of hers, and I would send it out before I even got mine. And that's how it happened.
All right. So what happened next after that?
'Cause so much happened. Well, as far as the doctors and, you know, the chemo and the surgeon, when they said that they couldn't do anything else for her, it kind of became like a blame game.
You mean the doctors blaming each other?
Oh, yeah. Well, even with the doctor not being affiliated with the clinic anymore, right? That became a blame game too. You know, like, oh, you can't use him. He's incompetent. He's not this. He's not that. But he was God in the very beginning. You know, he was everything. Oh, he's wonderful. He's great. He's the best that we have. And he's this and he's that. And which he really was. You know, when my brother came from California, he walked up to the doctor. He said, listen, I'm the overprotective uncle, and I don't play with my niece. And the doctor said, great, because I'm the overprotective doctor, and I look at her as my daughter.
Okay.
And he really treated us as that, you know. So, I mean, so much went on. so much. We definitely had help from the fund too, because there were some things like, you know, that are out of network, and some things that just weren't covered. Like I had medications that weren't covered. When she started really having a problem in her feet, she went from 300 milligrams of Neurontin for her neuropathy to 600 milligrams. And every milligram is $100.
Okay.
So that was like a $600, you know, and it was like, well, how am I supposed to handle that? So it turned around that, okay, well, you can't get it from the hospital. If you get it maybe from a pharmacy, it'll be cheaper than getting it from the hospital. The pharmacies didn't carry that. So it was, okay, well, you have to call your insurance, and you may have to get it through specialty. So we had to do that. You know, we were getting it through specialty, which was a $75 copay through my insurance versus $600 through the private, you know, like a CVS or something like that. So I had to deal with that. Then there came a time where the pharmacy didn't take her insurance at all.
Okay.
at the hospital. So I couldn't get any of her meds from the hospital. Being inpatient, I had to run to the pharmacy down the street to get her medication to bring it back. Did that a couple of times, but then I said, you know what? This makes absolutely no sense. Somebody is going to have to do something because I'm leaving her here to go to the pharmacy, to stand online, to get the medicine, to come back, to get it to whoever, whatever department here, then back upstairs with her. That's taking too much time away from her. And I feel like I'm doing too many other people's jobs.
Right.
You know? So the fund said, we'll handle it.
Okay. The fund. Can you tell us about
Yes,
the fund?
The fund is, it's called the Tomorrow's Children's Fund. Every hospital has a fund. Every hospital.
Every hospital.
Every hospital has a fund.
Okay.
Okay. For this particular fund, they help people get back and forth to the hospital because people come from all over
Okay.
to have treatment there. It's a children's hospital. They took up some of the costs for LaTisha's medication when, you know, it wasn't covered by insurance. They would give me gift cards to pay for it. They pay a lot of your bills for you. They kept us afloat probably for about 3 years out of her illness because, you know, things get tight, things get tough. You know, you're not working. I had exhausted all of my funds from wherever they were. So now you just have job protection with no money. So, you know, they pay the rent, they pay the PSE&G bills, they do a lot of different things for the kids, like for their birthdays, because a lot of them spend their birthdays in there, holidays, and all types of things. So they try to make it as normal as possible, you know. So the fund is very, very important. I've had so many people come to me and say, you know, wow, since your daughter got diagnosed, you know, I've been donating to the American Cancer Society. I want to help. Okay. I'm not to talk bad about any society or any fund or anything like that, but if you really want to help someone that you know is ill, donate to the hospital they're being treated at.
Okay.
Because
through the hospital's fund.
Right.
Okay.
Because
great information.
The funds is what really helps the patients.
Right.
You know, but if people don't donate, they can't help.
Okay.
You know, and
that's
where we are.
How can they donate to the children's fund?
The Tomorrow's Children's Fund. It's at the Hackensack Hospital.
Okay.
And it's just called Tomorrow's Children, you know, TCF, Tomorrow's Children's Fund. The lady's name is Nan. You can just call, you know, the main number at the hospital and ask for Tomorrow's Children, and you want to make a donation. And they will take your information and they will mail you something, and it'll explain to you what your money is going to be used for.
Okay.
I think like about $50 they say is for a child's birthday. I think they have a slot for $5,000, which is for like sending a child on a trip, or you know, they work very closely with the Make-A-Wish Foundation.
Right. Okay.
And also there's another fund called the J Fund who graciously donates to Tomorrow's Children, along with the Jillian Fund who also graciously donates to Tomorrow's Children. And these are parents of kids who have passed away due to cancer.
Right.
And they were treated there. So they're giving back to...
We'll put the information on the site so that anybody who wants to make a donation can do so.
Yes, because it's very important, you know, because there were times that I would go to the fund for whatever, and it was empty. It's like, we don't have it. We can't do it, you know. So it's tough, you know, it's tough. And I would even see so many kids there alone, you know, because...
So you can volunteer to...
Not in 2019.
Oh, okay. I'm trying to cover all the bases for anybody who wants to help.
You know, it's so much HIPAA stuff, and it's so much. So they really don't let people in.
Okay.
But I'm sure if you volunteer through the hospital, you can get to that particular side. But again, it's our children, so they're very
protective.
Yes,
obviously,
very protective. A lot of security. You know, you really, you can't get up in there.
No, and that makes perfect sense. I guess in the moment I'm thinking a child alone in this condition is not the most ideal.
Right.
All of us need someone around us when we're not feeling good. So
Right.
to imagine that there's a child that might
Be right. And I've seen it.
yeah,
I've seen it. But in some situations, you have the single parent, excuse me, who has to work, who doesn't have any help, doesn't have anybody.
right.
And I saw it a lot. You know what I mean? I saw it a lot. And
It's just heartbreaking.
it's heartbreaking.
Yeah.
And when I saw those situations, I made sure that I would speak to the parent. Listen, when
Okay.
you're not here, whatever your son or daughter needs, and that's how you make friends there. Because
Right. I'm pretty sure there must be a network of parents that come together.
there are.
And,
There are. But sometimes, they used to have like they had like a group for the parents. It was once a week. All the parents can come down. They would order food, and we would sit and we would talk and kind of exchange, stories of what
Right.
was going on with your child. What does your child have? What were you diagnosed with? What's the form of treatment for your child? And we would talk about that. And it got to the point where I think we were sharing a little bit too much with each other,
okay.
and they stopped it.
Okay.
So, yeah, I mean, it would be great if we had a room, a place.
Right.
But because some parents don't want to talk about it.
Right.
You know,
It's a hard subject.
Yes, because I've had
It is a
parents
hard
that
subject.
didn't even want me in their room. Like, listen, I'm just going to go buy a newspaper. Do you want a newspaper? And they'd be like, no, I'm fine. So some people don't want to be bothered with it because they don't know what to say, what to do. They're scared. They're upset. And they're alone.
The grieving process is very difficult because you start, even though you shouldn't start that process, while the child is sick.
Mm-hmm.
But I think when I say grieving, I'm not talking grieving where death is concerned, but just a grieving that your child is sick.
Right.
There's something very heartbreaking for a parent to watch their child in any kind of discomfort.
Yeah.
And I just know that sometimes you can shut down.
Mm-hmm. And they
Yeah.
do. I'm sure that I did.
Yeah.
I had one person that was definitely by my side from the beginning and even to this day.
Okay.
She's still there, and that's Reverend Gwenny Burt, and
Okay.
she has definitely been the angel sent by God. I'm telling you, because so many times we want certain people, we feel certain people should be there, but I'm going to tell you, when they say you know who your friends and your family are, when something goes wrong, that is a very true statement, because like everybody just kind of walked away.
I think it's hard for people to be in the presence of
Yes.
of individuals who are going through things.
Mhm.
It doesn't matter what you're going through.
Right.
If you're going through a hardship, you kind of don't know what to say to that person.
Right.
You kind of don't know what's the appropriate
Mm-hmm.
what's the appropriate conversation.
Mm-hmm.
What's the appropriate response?
Mm-hmm.
Let's talk about that for a little while, because I
the
think that's
appropriate
important.
response is just being honest. Listen, I don't know what to say. I
Okay.
don't know what to do, but I just want you to know that I'm here.
Okay.
Whatever you may need. If you need to talk, you need to cry, you need to just go for a ride, you need to go grab a bite, I'm here. You tell me what you need.
Okay.
But if people don't say that and they just kind of skate off and disappear, that person is felt, they're just left alone. So it's like, okay, was that really my friend? Is that really my family member? Like, they don't even call to see if I'm okay. They know what's going on. They don't send a card. They don't cook a cake, nothing.
So it's okay to say, hey, I don't know exactly
Absolutely.
what I can do,
Absolutely.
but whatever you need me to do.
Absolutely. And say you don't even know what to say. Because
Because
some
you
people say
don't.
crazy stuff too.
Because you don't know
Right.
what to say.
So just make that clear. I don't know what to say,
Okay.
but I want to be here for you. I don't even know what to give you. I don't know what to do, but I want to be here for, even if it's just me sitting there. Because sometimes Reverend Burt would come and she would just be present. She didn't always say anything. She didn't always do anything. She was just there. And sometimes just being there means more than anything.
Okay.
You know what I mean? And I don't know. It was like God would tap her on the shoulder and say, okay, in about an hour and a half, Tish's going to be in the ER. Go there. Because when we got there, she was there. And I'm like, who called her? How does she know, we were here? So sometimes just being there is all a person needs.
Okay.
Just to be there.
Just show up.
That's
Just be
it.
there.
Just be there.
Sometimes even in silence.
Yeah, absolutely.
Okay.
Absolutely. Because
Good
then
to
it
know.
makes, it made me feel like I wasn't alone and that I did have somebody to turn to. Even though in the beginning, I was like, where did she come from? You know, I didn't even, we didn't even have a relationship like that, you know, but God sent her there. And she was a fixture there for the whole time, And she helped calm me down. She helped, you know, well, remember you said you wanted to ask the doctor this, or remember this happened. And, you know, so stuff like that is important.
Okay.
It's very important.
And what about your family? Not in a sense of I know your family cares, but this didn't just affect you.
Mm-hmm.
It affected your family. It affected your mom. It affected your daughter. It affected your brother. It affects a whole lot of people.
Well, family was very distant as well. This is why my brother came from California, because he knew that nobody was there. So
Out of fear, out of not knowing what to say, not knowing how to approach. I mean, I never want to demonize people, because it is difficult sometimes for people to respond in a way that people want you to respond. A lot of it has to do with fear. A lot of it has to do with I don't know how I can help. I don't want to deal with it myself, because this is their loss too.
Right. Well, it was said to me, you know, I don't know what to do or say. But what really bothered me the most was I can't stand to see her like that. And
Probably a true statement.
it is a true statement. But I said to the person, I can't stand to see her like that either. So, but I have to be there because that's my daughter, you know, and just like my daughter needs me, I need you, you know, and still, you know, it didn't register to that person because they still, you know, kind of was a distance, was afar, or, you know, whatever. So that's why I had, you know, I had said before, don't try to plan who you want to be with you through your journey, because God is going to send you who you need to have.
Okay.
Because the ones you think are going to be there, the ones you think that you need, no. So yeah, I really thought that my family would really be by my side, you know, during this whole journey, especially since they're here. But no. Oh, no.
Okay, well, what advice do you give to family members even now? Because I think even now sometimes we forget that individual still needs us, even today, even now, even if it's been 5 years, even if it's been 10 years. What advice do you give to family members who may be thinking, okay, it's some time has gone by, she's fine now, or there's nothing I can do now? Because you're not the only family that has gone through this. So I'm speaking to the families outside of this walls that we're in here right now that may be also going through a situation where they felt alienated from their family. It's not too late, right? It's never too late to heal those wounds.
Right.
So what advice do you have to families now?
Well, I will say this. Losing a child is probably the worst. You know, I mean, my mom is still walking around, so I don't know what it's like to lose a mom. My grandmother is still walking around. I don't know what it's like. I don't know what it's like, but I do know what it's like to lose a child.
Okay.
And that's probably something that a mother will never get over. We just learn how to deal with it every day. As far as what can a family member do, don't ever suggest that they should be over it.
Okay.
Don't ever think that enough time has gone by, because in May it'll be 5 years for me that my daughter's been gone, and I still dream of her funeral. I still see her laying in ICU. I still, you know, see her sitting on the couch crying, asking God why. You know, it's so many different things that I still see every day. And just like as if the child was here going through the chemotherapy and the treatment, just like, you can say, I don't know what to say, I don't know what to do, but I'm here. It's the same thing.
Okay.
It's the same thing. I don't know what you need, but just know whatever, I'm here. Call me, text me, come to my house, whatever. You want me to come over and just talk, whatever. Any type of help and I don't mean like financial and
Right,
like,
no, I know.
just anything, listen, can I bring you a meal? Can I take your daughter for a little while? Can she go to the movies with my daughter? Something like that, just to kind of give you a peace of mind a little bit, kind of gather your thoughts.
Right.
Because life does still go on.
Yes.
But many of us are stuck. Like I have a mom right now who her daughter passed away 7 months after my daughter. She's still stuck. Her daughter was 10 when she passed away. And she didn't even have cancer. She had a form of anemia that they treated with chemotherapy.
That's a subject I'd like to talk about, if we can briefly talk about that for a minute. I had a conversation with you, so you know that I also was treated with Lupron, which is a what is it, a prostate cancer drug?
It's a drug for prostate cancer, yes.
Right. I had fibroids, and they gave me that drug. I had the 3 shots for 3 months, and it was the most devastating 3 months of my life. That was in 2011. It is 2019, and I am still suffering the side effects of that drug. Still don't know what's in store for me, to be quite honest with you. Every time I turn around, something else is starting up.
Right.
Why do they do that?
Well, unfortunately, it ain't about you.
Somehow I didn't think it was about me, but why do they do that?
It's about the money.
Now, okay, we might be getting into some shaky ground right here, but I'm a rebel like you. So they work in cahoots with the pharmaceutical companies.
Absolutely. They
So
get
if the
kickbacks and all
pharmaceutical
that.
company says, we want you to push this, they push this without any kind of thought.
No, none at all.
Wow.
None at all.
Yeah, I kind of knew that, and I kind of I felt some kind of way after I took myself off it. My doctor still
They would have you on it forever.
She still wasn't trying to take me off this drug.
So let
but
me
like
ask
you, I did my research after I was trying to figure out what was going on with me, and saw all this stuff.
Yeah.
And I took myself off of the drug.
The saying goes, why bill your insurance? Why cure you and bill your insurance once when we can treat you for the rest of your life and bill your insurance? That's the way it goes. If they cure you, you're never coming back. So just imagine if a doctor had a practice of 50 patients and every last one of those patients he cured. He no longer has a practice now. Because who's coming to him? Nobody. You cured everybody.
But isn't that your role and your purpose?
Well, yeah.
I mean, your role and your purpose is to cure people.
Yes, it is. Back in, let's say, the 50s, 60s, and 70s, maybe 80s. But it's different now. It's different now. It's all pharmaceutical. It's all about business. It's all political. You know what I mean? And it's all about the money. You know, like even where, some of these hospitals, the more property and things they build up and they add on, the less insurance they take.
But tell me how they can get away with giving she was 10 years old, this child?
Yeah, she passed away at 10.
Anemia is not a disease itself, am I correct? It's
a blood disorder.
It's a symptom of something.
It's a blood disorder. It's a low count of your blood cells, like the white blood cells or red blood cells, depending on what type it is.
Right. But it's a symptom. Like, okay, I've had anemia all of my life, but I have beta thalassemia, which is the cause of the anemia because of the white blood cells. So anemia in itself means that there's something else wrong, right? Anemia in itself is not a disease.
No, it's what they call it because it's something else going on. Like she had, I think it's called ischemic anemia.
Okay.
But her father also had it, and it was just like a very low blood count.
Okay.
And even when they gave her blood, it's still, and it just, her counts never stayed up. So they started even dealing with her bone marrow. They said, oh, it could be something with the bone marrow. She had a bone marrow transplant and all this stuff.
But why chemotherapy? What does chemotherapy do for anemia? That's what I'm trying to find out.
Well, I guess they feel like because the chemotherapy destroys everything, maybe if it destroyed everything.
Yeah, but it also destroys good cells too,
oh, yeah,
don't
absolutely. Absolutely. It destroys everything. And they feel like kids are resilient, that they will bounce back. They feel like kids are stronger and their blood and stuff will build up stronger and better. Now, with my daughter, I actually, in the beginning, I felt that could have been true because she was bouncing back like this from major surgeries, major treatment. And the nurses were like, wow, she don't want to be here. She's up, she's walking around, she's doing this, she's doing that. So it's the money, honey.
The money, honey.
It's the money. And I mean, I'm glad that we're talking about this because when I say with the bone marrow, this is going to bring me into how important it is to be involved in studies.
Okay. Okay. Studies that
like the
clinical
trials and things like that.
Okay. So you think it's a good idea to be involved in those?
Especially for us.
Okay.
Especially for us because we don't do it.
Right. That's why I'm a little bit shocked. You see the shocked look on my face, right? Because we don't do it.
We don't do it.
But
we're afraid.
But in all fairness,
yeah,
you can understand why black people are afraid to be involved in clinical trials.
I do.
We have a history of them not going so well for us. But you're sitting here, you're saying that you think it's a good idea.
I think
Tell me why.
It is. And the reason I'm going to say why, when they introduced us to the study, I asked them, why should we be in